In this morning's STL Mom segment, heart disease, the leading cause of death for women, especially during pregnancy. February is American Heart Month, a good time to raise awareness about heart health and how to care for yours during pregnancy. Dr. Amanda Verma is a Washington University cardiologist at Barnes Jewish Hospital. She's with us this morning with some advice you need to keep in mind. Good morning to you.
Good morning. Thanks for having me.
Absolutely. So first off, what happens to your heart during pregnancy?
So during pregnancy, you have to have enough blood to circulate to the baby. So your blood increases in volume by about up to 50%, and your heart has to work harder to carry that blood. And in part, it does that by increasing your heart rate and decreasing your blood pressure.
So, are there potential heart problems that women who are pregnant need to be aware of?
There are some rare ones like heart failure and what we call peripartum cardiomyopathy, but the one that's most concerning and affecting many women is preeclampsia. It affects about 1 in 20 women. It can affect multiple parts of the body, but usually what happens is the blood pressure goes up, and you can also be at risk for seizures and even death. The other interesting thing about it is that it's not just during pregnancy that it can affect a woman. It can affect the woman throughout her lifetime, increasing her risk for heart disease up to 2 times in her life with things like heart attacks, strokes, and heart failure.
That's a lot of women.
That's a lot of women.
Yeah, that is affecting who are pregnant. So at what point do they need to go see a cardiologist?
So if a woman has had pre-existing heart problems, such as an arrhythmia or an abnormal heartbeat or congenital defect, they should see a cardiologist before they get pregnant to hopefully improve their cardiovascular health. And then anyone who's had a cardiac problem during a prior pregnancy or developed something during pregnancy should also see a cardiologist.
Yeah. So what are some things that women can do, to stay heart healthy? I would say during pregnancy, but honestly, even before, if you're thinking about getting pregnant, right?
You're exactly right.
Yeah.
So the best way to do this is to prepare ahead of time. So keeping your body healthy by exercising, having a healthy diet, addressing any problems like high blood pressure, high glucose. That should be done during pregnancy and before pregnancy. And during pregnancy, what's really important is to just be aware of symptoms that you may experience that could be the signs of early heart problems, and advocate for yourself, because a lot of the symptoms of pregnancy mimic heart symptoms. So things like shortness of breath and swelling, if they're not getting better or they're getting worse, it should really raise some red flags and have you talk to your doctor about what to do next.
Some very good advice for us this morning in this Heart Month. Thank you so much.
Thank
we
you.
appreciate it, Dr. Amanda Verma, for your time this morning.
Thank you.
All right.